The world of adult congenital heart disease is so unique that you really take everything that's out in adult cardiology, so all the research and the nuances, and you try to put your mind together and say, can I apply this in the world of pediatric cardiology, or can I apply this world of congenital heart disease? Sometimes it works, and sometimes it doesn't. And I can flip it around and say, well, there are some nuances of pediatric cardiology that we do in infants and children and 2 years old or infants or a couple of months old. And I sometimes turn around and say, can I use this knowledge and this research, and can I apply it to the 25, 30-year-old with congenital heart disease? And sometimes I can, sometimes I can't. So my world is such where I can use the world of adult cardiology and bring it to adult congenital or pediatric cardiology, and I can flip it and say I can use pediatric cardiology and bring it to the world of adult congenital. So yes, I mean, you pick and choose as to what's needed. We're doing a lot of research. We've done several multi-center trials that we're doing with adult congenital heart disease. We're doing our own research here in Montefiore, looking at several different aspects of adult congenital heart disease. One of the things we're looking at, interesting that you bring up, is the use of ventricular assist devices in adult congenital heart disease. So what is the data out there, and what are the factors that we need to look at and say we can apply a ventricular assist device to an adult congenital patient? So we're looking into that. One of the things that really caught my interest, which is not so much a clinical research arm, but it really is the national costs and aggregates that is applied to adult congenital heart disease, and what's happening to these patients, and who's paying for them, and what do the insurances do, and is this a cost burden that is now going to come and hit the adult world? And it's fascinating data when you look at the national cost aggregates. It is in billions that is being applied for adult congenital heart disease. When you look at the national data, so hospitalizations, ER visits, clinic visits, ICUs, surgeries, procedures, imaging, pick what you want. The numbers are phenomenal. And we were recently just publishing a paper from Montefiore, looking at national data, looking at the costs and aggregates through what's called the nationwide inpatient sample. And it's staggering. The costs are staggering, and I actually call it the tsunami that's going to hit in the next 5 years. That if our healthcare administration or leadership or insurances or whatever you want to call it don't pay attention to this, this will become a massive tsunami. It's going to come and hit. Especially with the change in Obamacare and as life goes on, I mean, this will be an increasing cost burden on the healthcare system. I think the way congenital heart disease works is that if you don't do anything, then that is you're applying that to a young patient. So you're not going to do something in a 25-year-old, and that is not something that we do in congenital heart disease. You know, so if it's a 25-year-old who needs a 4th open heart procedure, we will do it. If it's adult congenital heart disease and a woman's pregnant and we have to get her through pregnancy, it leads to an ICU admission or management, we will do it. I mean, that's what it is. So the cost burden is certainly there. Very rarely do we turn away an adult congenital patient and say, well, we're not going to do something from a cost standpoint. I mean, the world is very different when it comes to congenital heart disease. As this world grows, as these patients grow, and as we do more and more with adult congenital heart disease, we need to train more physicians. We need to train physicians in adult congenital heart disease so they understand that this is a cohort of patients that is only growing. We need more physicians coming into the field. I do worry that as in the next 25 years, as my career goes on, hopefully we'll have more young physicians coming into the field because that's what we need. These patients are only growing, and as I said, you've got 1.2, 1.3 million patients, and you've got 70 doctors. So look at the numbers.